partner, and good morning, world.
Or the universe rather, partner. Good morning to you as well.
I am Gennazareth S. Dimailig.
And I'm Cliff Johnson C. Garcia, and this is
Bio 101. Our group will discuss about the respiratory system and circulatory system,
Its parts and their respective functions,
a genetic disease for each system, and how the inherited disease affects the system.
how is it acquired, and if there is already an available treatment.
The cells of the human body require a constant stream of oxygen to stay alive. The respiratory system provides oxygen to the body cells while removing carbon dioxide, a waste product that can be lethal if allowed to accumulate. There are three major parts of the respiratory system, namely the airway, the lungs, and the muscle of respiration. Through breathing, inhalation, and exhalation, the respiratory system facilitates the air and the blood and between the blood and the body cells. The respiratory system also helps us smell and create sound. There are 5 key functions of the respiratory system. First, the inhalation and exhalation are pulmonary ventilation, that's breathing. Second, external respiration exchanges gases between the lungs and the body stream. Third, internal respiration exchanges gases between the bloodstream and the body tissues. Fourth, air vibrating the vocal cords creates sounds. And fifth, olfaction or smelling is chemical sensation.
Every tissue within the body requires oxygen to function. The respiratory system, which includes air passages, pulmonary vessels, the lungs, and the breathing muscles, provides oxygenated blood to the body tissues and remove waste gases.
The respiratory system is composed of two main components. First one is the upper respiratory tract. The second one is the lower respiratory tract. Upper respiratory tract, it is composed of the nose, the pharynx, and the larynx. The organs of the upper respiratory tract are located outside the chest cavity. Nasal cavity, inside the nose, the sticky mucous membrane lining the nasal cavity traps dust particles and tiny hairs called cilia to help move them to the nose to be sneezed or blown out. The mouth, also called the oral cavity. The mouth is a secondary exterior opening for the respiratory system. Inhaling through the mouth allows more inhalation, as the oral cavity is far larger than the nasal cavity. Next one is the pharynx, also called the throat. The pharynx is a funnel of muscle that extends from the respiratory openings to the esophagus and the larynx. Last one is the larynx. The larynx is essential to the human speech. Aside from being essential to human speech, the larynx also acts as a defense mechanism. If any food passes into the esophagus when swallowing, the larynx produces a strong cough reflex.
The second component is the lower respiratory tract. It is composed of the trachea, the lungs, and all segments of the bronchial tree, including the alveoli. The organs of the lower respiratory tract are located inside the chest cavity. First is the trachea. The trachea is located just below the larynx. The trachea is the main airway to the lungs. Inside the trachea, small hair reside upon the inner walls. Second is the lungs. Together, the lungs form one of the body's largest organs. They are responsible for providing oxygen to capillaries and exhaling carbon dioxide. Third is the bronchi. The bronchi branch from the trachea into each lung and create a network of intricate passages that supply the lungs with air. Fourth is the diaphragm. The diaphragm is the main respiratory muscle that contracts and relaxes to allow air into the lungs. And last is the alveoli. Alveoli have extreme thin walls that allows the exchange of oxygen and carbon dioxide to take place within the lungs.
What a beautiful sunny day, partner!
Indeed it is. Moving on, let us discuss the genetic diseases. And now we have a very special guest. He specializes on respiratory diseases and a pulmonologist.
So may we call on Dr. Alvin.
Thank you, Miss Jenna, and thank you, Cliff. So before I will be discussing about how cystic fibrosis affect the respiratory system, let us have a small recap about what cystic fibrosis is about. Now, cystic fibrosis is a life-threatening genetic disease that causes lung infections and also progressively limits the ability to breathe due to an abnormality in a a buildup that produces sweat and mucus. So, how does cystic fibrosis affect the respiratory system? Individuals who are suffering from CF, or also known as cystic fibrosis, usually have a defective gene that causes a buildup in mucus, and it affects the lungs, pancreas, and other organs in the body. Now, in the case of cystic fibrosis affecting the lungs, mucus clogs up the airways, and it also traps the bacteria, which means that there will be infections as well as it will cause damages in the lungs, resulting to respiratory failure. Now, in the case of cystic fibrosis affecting the pancreas, the mucus prevents the release of digestive enzymes that allow the body to break down food and to absorb vital nutrients. So, mucus in the paranasal sinuses cause blockage of the sinus passages, which leads to infection, resulting to fever, facial pain, and headaches. Also, cystic fibrosis affects the liver in terms of abnormality in bile production. Take note that bile production is a fluid that is essential for digestion of fats and neutralizing acidic contents in the body. So the bile becomes more dehydrated and it becomes more acidic, which has an effect on the lining of the intestine because of high acidic contents. So what our body does is that in response to these type of infections, the body immune system sends white blood cells to the lungs in attempt to destroy the infection. And also, white blood cells release chemicals that kill the infections or the bacteria that is affecting other cells in the body. After attacking the bacteria, the white blood cells adds to the thickness of the mucus and to the destruction of the airways.
So, Doc, what are the complications of cystic fibrosis affecting the respiratory system?
Okay, so there are a few complications of cystic fibrosis affecting the respiratory system. First would be chronic cough. Second would be coughing up blood. And third would be rubbing or the enlargement of nails in our fingers and in our toes. So those are the few complications of cystic fibrosis affecting the respiratory system.
So thank you, Doc Alvin, for visiting us despite your busy schedule.
Bio 101 will be back soon. And we're back.
Partner, are you curious about how cystic fibrosis acquired?
Yes, actually. So, for us to learn more about cystic fibrosis, let us call on Dr. Jacob.
Hello, Dr. Jacob.
Hi, sir.
So, thank you for having me here. So, I am Dr. Jose Carlos Oña, and I am also a pulmonologist. So, people with cystic fibrosis inherit a defective or infected gene in the chromosome 7, also called the cystic fibrosis transmembrane conductance regulator, or the CFTR. The mutation in the CFTR causes the deletion of 3 bases in the DNA, which causes the 1 amino acid code which is not coded for. So people with cystic fibrosis inherit both recessive genes from both their parents. So both parents must pass on the infected or defective gene on the chromosome 7, and they must both pass it on to their children or any of their offsprings to bear the disease. So if one of their offsprings only inherit 1 copy of the defective gene from either of their parents, they will only be labeled as carrier. Carriers don't actually have the disease, but they can pass it on to their offsprings if they also have an offspring with a spouse who also possesses the defective gene for cystic fibrosis.
Thank you, Doc Jacob, for that educational yet confidently beautiful
With a heart. And we'll be back soon here at
Bio 101.
Oh,
And we're back here at Bio 101. Together with us is Dr. Elaine.
And we're currently here in her office.
Thank you, Jenna and Cliff, for having me here.
So, Doc Elaine, I'm very curious. Can you tell us how cystic fibrosis is treated?
Actually, there is no cure for cystic fibrosis, but there are several available treatments that can ease symptoms, make the condition easier, and prevent long-term damages or complications, which is caused by infections. Treatments can be classified into different types, including medication, chest physical therapy, pulmonary rehabilitation, advanced lung disease treatment, and cystic fibrosis complications treatment. The first treatment, medication, includes 10 common treatment are antibiotics, mucus-stilling drugs, bronchodilators, or oral pancreatic enzymes, pulmozyme ordinase, hypertonic saline, mannitol dry powder, bisophosphonates, steroid medication, and of course, the most important is it includes the well-balanced diet. The second type of treatment is chest physical therapy, or CPT. It helps loosen mucus, which makes it easier to cough up. It is usually done 4 times a day. It can be done using 2 techniques. The first is the common technique, and second is using mechanical devices. The common technique includes clapping with cupped hands this way, in front and at the back of the chest. The mechanical devices includes using of vibrating vest, tube, or mask. Another type of treatment is pulmonary rehabilitation. It is a long-term program to improve the lung function and the overall well-being of the patient. It is usually done on outpatient basis. It includes exercise training, nutritional counseling, breathing technique, psychological counseling, and group support. Fourth is advanced lung disease treatment, which can be classified into 2. It can use the oxygen therapy or the lung transplant. Last treatment is for cystic fibrosis complication. The most common complication is diabetes. We are all familiar that insulin is the best treatment for it. So, Cliff, that answers your question.
Thank you, Dr. Elaine, for that informative and
Major answer to my question.
and that concludes the respiratory system for Bio
101. The purpose of the circulatory system is to carry blood throughout the body to carry the organs and other areas of the body that need it, and to carry gaseous waste to the respiratory system so that it can get rid of them. The ventricle receives blood from the atrium and the ventricles pumps blood to the artery. Arteries carry the blood away from the heart. Since it carries red blood cell, you can get oxygen throughout your whole entire body. The functions of the circulatory system would include, first one, respiration. Delivers oxygen to the cells and removing carbon dioxide from them. Next one is the nutrition. Carries digested food substances to the cells of the body. Next one is waste removal. Disposes of waste products and poison that would harm the body if they accumulated. Immunity. Helps protect the body from disease. Cellular communication. The circulatory system provides a mode of transport of hormones. Thermoregulation. The circulatory system transports heat, can both warm and cool body. The circulatory system comprises of 2 separate systems. First one is the cardiovascular system, distributes blood. Second one is the lymphatic system, part of the circulatory system and a vital part of the immune system, comprising a network of lymphatic vessels that carry a clear fluid called lymph, directionally toward the heart.
The circulatory system is a body-wide network of blood, blood vessels, and lymph. Powered by the heart, it is the body's distribution system to the organs with oxygen, hormones, and essential nutrients that helps it function properly. Combined with the cardiovascular system, the circulatory system helps to fight off disease, helps the body maintain a normal body temperature, and provides the right chemical balance to provide the body's homeostasis. The circulatory system consists of 4 major components: the heart, the arteries, veins, and blood. The heart. The heart is about the size of 2 adult hands held together. The heart rests near the center of the chest. Arteries. The arteries carry oxygen-rich blood away from the heart and where it needs to go. Veins. The veins carry the oxygenated blood to the lungs where they receive oxygen. And lastly, the blood. It is a transport media of nearly everything within the body. It transports hormones, nutrients, oxygen, and antibodies and other important things needed to keep the body healthy.
So what happens is that the oxygen enters the bloodstream through tiny membranes in the lungs that absorb oxygen as it is inhaled. And as the body uses the oxygen and processes nutrients, it creates carbon dioxide, which the lungs expel as you exhale. A similar process occurs with the digestive system to transport nutrients as well as hormones in the endocrine system. These hormones are taken from where they are produced to the organs they affect. So there are also three types of circulation that occur regularly in the body. So the first would be the pulmonary circulation, second would be the systematic circulation, and the third, coronary circulation. Now the pulmonary circulation, this part of the cycle carries oxygen, depleted blood, away from the heart to the lungs and back to the heart. The second would be the systematic circulation, wherein this part carries the oxygenated blood away from the heart to the other tissues of the body. And last, the coronary circulation. This type of circulation provides the heart with oxygenated blood so that it can function properly.
So due to public demands, Bio 101 has decided to bring back Dr. Jaco to discuss about rheumatic heart disease. So good morning, Dr. Jaco.
Good morning again.
Nice meeting you again.
So, rheumatic heart disease, or RHD, is the most common acquired heart disease in children in many countries of the world, especially in developing countries. RHD is a chronic heart condition caused by rheumatic fever that can be prevented and controlled. Rheumatic heart disease, or RHD, describes a group of short-term or acute and long-term or chronic heart disorders that can occur as a result of rheumatic fever. One common result of rheumatic fever is heart valve damage. This damage to the heart valves may lead to a valve disorder. So rheumatic heart disease affects the circulatory system by damaging the mitral valve or the aortic valve or both. The damage in the valves cause them to leak and be narrowed over time. With this, the damaged valves cannot open or shut properly, which interferes with the proper blood flow of the heart. Because the valves cannot function properly, problems will arise which will include being short of breath by doing any particular activity. The patient may also experience joint pain and inflammation and chest pain and swelling unless properly treated. So an example of long-term complication because of RHD will include heart failure, making the heart unable to pump blood properly and even enlarging it due to the strain. It may also induce ischemic stroke due to the clot formed by the damaged valves or even the enlarged heart. The clots cause blockage in the blood vessels in the brain, resulting in stroke.
So yun, thank you, Dr. Jaco, and for guesting. And then we would like to greet anyone.
I would just like to greet your partner and fellow host, Gennazareth, Dimailig. That's all.
Moving on, how rheumatic heart disease is acquired. With me is Dr. Elaine for us to discuss it further.
So, rheumatic heart disease is the most commonly acquired heart disease in young people under the age of 25. It is a chronic heart condition and an inflammatory disease which starts from the complication of rheumatic fever. The rheumatic fever can be controlled and prevented. The fever is caused by a preceding group A streptococcal infection like strep throat or scarlet fever. It happens when the infection is not completely treated with medicine, and it may affect the heart, joints, skin, and the brain of the patient. Symptoms of rheumatic fever includes fever, of course, joint swelling, tenderness, redness over multiple joints, small bumps on the skin, rashes, weight loss, fatigue, and stomach pain. Rheumatic fever can cause serious, permanent damage to the valves of the heart. Most often, it damages mitral valve, aortic valve, or both. These valves act like doors in the heart that allow blood to pass between or out of the chambers on the left side of the heart. If the valves are damaged by rheumatic fever, they may not be able to open fully. This causes a narrowing of the valve, or the valves may not be able to close fully, resulting to a leak or not enough blood supply. If left untreated, rheumatic heart disease may progress to serious heart damage that kills or debilitates adolescents and young adults and makes pregnancy hazardous.
Thank you, Dr. Elaine, for the in-depth discussion of rheumatic heart disease. Up next, treatments for rheumatic heart disease. Stay tuned here at Bio 101.
Treatment for rheumatic heart disease.
Here with us is Doc Dom to explain the treatments for rheumatic heart disease.
Thank you, Jenna and Cliff. So, treatment for rheumatic heart disease is based upon the individual. As a doctor, I find for a number of things in order to define the treatment plan I will pursue for a particular person. These things include, first, the person's tolerance for specific medications, procedures, or therapies. Second, the person's expectations for the course of the disease. Third is the person's overall health and medical history. Fourth, the person's opinions or preference. And last, the extent of the disease. So the best treatment for rheumatic heart disease is the prevention of rheumatic fever, since rheumatic fever is the cause of disease. Antibiotics such as penicillin are commonly used to treat strep throat caused by strep A bacterial infection, as well as to stop acute rheumatic fever from developing. Reduction of the inflammation related to rheumatic heart disease can involve administration of aspirin. Steroids or non-steroidal medications can also be used. At times, surgery is necessary in order to either repair or replace heart valves that have been damaged.
Thank you, Doc Dom.
And this concludes the circulatory system.
Once again, I am Gennazareth S. Dimailig.
And I'm Cliff Johnson C. Garcia.
And this is Bio
101!